I'm Colin Ovington. I'm the Director of Nursing at Mid-Staffordshire NHS Foundation Trust, and I've been chairing the 6Cs conference here in London at the end of November. And today has been a really interesting day with fantastic presentations throughout the whole day, right through to closing. Thinking about each of the 6Cs as we go through the day, thinking about how they link together and how they align with one another in order to create the whole. And the key element in that is about the leadership in order to drive those things forward right through the organisation, but how culture is set by the tone of the leadership at the top of the organisation. And for nursing, that's a really important thing, because actually if we get it right at the top, it means that we can drive it through to ward level, to department level, and actually have our staff nurses and support workers working with us to drive through some of those cultural changes. And culture is thought of as a soft thing, but actually culture drives the actual performance of every key indicator that makes a difference to the physical health of every patient.
So then, a seventh C on top that could be added is challenges. What are some of the key challenges you think to pushing through the cultural change?
I think the challenges to the cultural change are very much about the amount of operational pressure the National Health Service is under on an ongoing basis. And that's not a complaint, that's just a reality of delivering healthcare in the 21st century. You know, with a lot of elderly people requiring physical health care as well as mental health care in the acute sector. For us, that's a real challenge, and therefore that's why the 6Cs are really important in getting some of those fundamental aspects of care crucially and very importantly right.
So one other issue I just wanted to quickly touch on is that strategy permeated well enough across the whole healthcare system, so outside of nursing and particularly hospital-based nursing?
I think it's an interesting question, because actually the 6Cs was developed as part of our national nursing strategy, but in talking to other colleagues it becomes very clear that for them the 6Cs are important to them also. I think the ownership, however, is being driven through the nursing fraternity, and hence it's become much more important to nurses to think about the 6Cs. But it is obvious to some groups of staff in other parts of the health system. For them, they talk about it. And I know, for example, I have a general manager in my own hospital who was thinking about assessing the quality of a cost improvement programme using the 6Cs as a framework, which for me was an absolute tremendous success.
So finally, 1 year into the programme being launched now, what are the next steps and what can you see in 2014?
I think the next steps are very much about continuing the drive forward. I think 1 year in is very much at a forming stage, and that actually the nursing strategy needs to go beyond just 1 year, and for the 6Cs to be driven into every organisation, and for us to consider how we're going to measure the 6Cs is going to be important. Some of the issues are very soft and it's difficult to know how they'd get measured, but it's an interesting conundrum to think about how you measure the whole rather than the individual components.